Trichosporon asteroids. Trichosporon asteroids is an asexual Basidiomycetous fungus first described from human skin, but is now mainly isolated from blood and urine. T. asteroids is a hyphal fungus with a characteristically yeast-like appearance due to the presence of slimy Arthroconidia. Infections by this species usually respond to treatment with azoles and Amphotericin B. History and taxonomy. Trichosporon asteroids was isolated from lesion of Malchian skin by Rinchen in Bern in 1926 and named in the genus Physiology. T. asteroids was later reevaluated by Masao Ota and transferred to the genus Trichosporon as T. asteroids. Ota noted that its hyphae were more sparsely branched than other species in Trichosporon, and it lacked the ability to ferment glucose, maltose, sucrose, and fructose. Molecular phylogenetic study has since supported the placement of T. asteroids in the genus Trichosporon. T. asteroids was determined to be conspecific with Fischericella filamenta on the basis of DNA/DNA reassociation. Modern classifications support the affiliation of this species with the order Tremolales in the phylum Basidiomycetous. Growth and morphology. T. asteroids grows in a range of media, including in the presence of the antifungal agent, cyclohexamide. Colonies of T. asteroids grown on sabarod agar appear white in color with a brain-like texture, reaching a diameter of 10 mm after 10 days growth at 25 deg C 77 deg F. Colonies have radially furrowed outer zone and matte appearance that is not powdery like the related species, T. asahiae. Antibodies produced by infected patients can also be used to differentiate T. asahiae and T. asteroids in disease. Weak growth is seen at 37 deg C 99 deg F but is absent at higher temperatures. T. asteroids can be distinguished with other relative species in the genus Trichosporon by its ability to utilize D-galactose, L-rhamnose, erythritol, and L-arabinitol. Physiology and pathogenesis. T. asteroids does not ferment glucose, maltose, sucrose, or fructose. This is the common feature to all the species in Trichosporon. T. asteroids causes trichosporinosis, which mainly responsible for deep-seated, mucosa-associated, superficial, and systematic infections, including blood. This species is one of the 3 most common Trichosporon species isolated in clinical settings. The fungus is sometimes recovered from specimens of blood, urine and aspiration fluid, vaginal mucosa, male perigenital skin area, and catheters. The first record of this agent in a systemic infection involved a bloodstream infection. Some main types of latent infection can be raised or fungemia, allergies, and systemic infections can also be caused by this fungus, particularly in immunosuppressed people. Recently, T. asteroids was implicated in a case of Kurien-Selce, a rare, highly inflammatory scalp infection seen mainly in children. This fungus is rarely encountered in zoonotic infections and has never been shown to cause disease on insects. However, T. asteroids was isolated from the multifocal, irregularly raised skin lesions on a female bottle-nosed dolphin, Tursiops truncatus, in Japan. In the absence of cultures and molecular biological analysis, the agent was initially suspected to be Paracoccidioides seti, a worldwide causative agent of paracoccidioidomycosis in dolphins. Treatment. Azole antifungals are often used as a frontline therapy in trichosporinosis. Resistance to amphotericin, flucitosine, fluconazole, and itraconazole have been described. Echinocandins, as a group, are ineffective against Trichosporon species. Triazoles show better in vitro and in vivo antifungal activity than Amphotericin B, while voriconazole also has excellent in vitro activity against Trichosporon asteroids. Combination therapy regimens such as voriconazole and Amphotericin B are also effective in serious infections. Fluconazole has been used successfully in subcutaneous and deep infections. References